Hello everyone, and thanks for stopping by my channel. This is Dr. Tidman. I appreciate the time you're taking to review these videos. Today is the final part in my 5-part series of Blood Work 101, How to Interpret Lab Results from a Metabolic Health Perspective. Today's is going to be a little bit longer. There's a lot to talk about. Bone markers and supplements. These are the things that I am specializing in patients with osteoporosis, and I hope this information proves very useful for you. I'm a metabolic health practitioner for those of you who are new to my channel, and so a lot of what I present are my opinions based on my practice in metabolic health. So remember that this presentation is for informational and educational purposes only. If you want to make any changes in medications or your health, consult your own medical team. They know you better. So today I'm going to review common metabolic health markers that point to bone health. I'll also talk about some of the supplements that I recommend for bone health if you're having a problem with your bone health. I'll review the labs and the lab values, the relationship of metabolic health to bone health, and then some approaches you can use at home, my tips and takeaways. So I hope this proves to be educational and beneficial for you. So first, let's start with what is the role of vitamin D? I've heard a lot about vitamin D over the years, but vitamin D has some particular emphasis in bone health. Vitamin D works together with calcium and other minerals to build bone health and to keep your bones strong. Vitamin D assists in the absorption of calcium only if your vitamin D levels are sufficient. And what I'm finding is a lot of my patients come to me with abysmally low vitamin D levels. It used to be that these levels needed to be 30 or above, but now the research is showing they really need to be 50 or above. Calcium, of course, is a major part of bones, but it has other minerals that it needs to be in balance with. Magnesium, phosphorus, boron, selenium. There's a lot of minerals that go together to build healthy bones. We know that historically people with GI conditions that affects how the body absorbs fats, like ulcerative colitis and Crohn's disease, may not be getting enough vitamin D or any of the other minerals for that matter. The recommended daily amount of vitamin D is 400 international units, which, in my opinion, is very low. From a metabolic health perspective, we want your vitamin D intake to be much higher. So how do you get your vitamin D level tested? Well, vitamin D25 hydroxy is the name of the lab that you need your doctor to order. Deficiencies have been tied to increased risk for cognitive decline, cardiovascular risk, metabolic disease, poor sleep, cancer, and osteoporosis. The normal range for your vitamin D25 hydroxy should be between 50 and 100 milligrams per deciliter. Supplement recommendations would be taking 2,000 to 5,000 IUs a day if your levels are between 30 and 50. If your levels are below 30 milligrams per deciliter, you may need to take 10,000 IUs per day for a short period of time, maybe 3 months, and have your vitamin D levels checked again. Vitamin D works together with magnesium glycinate and vitamin K2 as MK7 to increase the absorption of calcium. So vitamin D needs to be in balance with some of the other minerals in your body. So, what is vitamin K2 as MK7? This isn't a lab test, it's a supplement. So, vitamin K2 as MK7 is found in animal products, but it's a vital nutrient that is supporting bone health and cardiovascular health. K2 as MK7 increases bone mineral density and promotes bone quality and strength. It works together with the calcium that you're taking to be sure it's sending the calcium to your bones. MK7 has a lot to do with the proper absorption of calcium and vitamin D. MK7 form of K2 is the highest bioavailable kind of K2. So you see that they work together. Calcium, vitamin D, and K2 as MK7. So what are collagen peptides? These again are things that you can take as supplements. Collagen plays an important part in bone mass, supports bone density, and can help to slow down the progression of osteoporosis if you've already got it. Collagen is a protein found throughout the body. It's important not only for bones, but for ligaments and joints, for hair, for nails, for skin. It has a lot of different functions. Collagen peptides are a type of animal collagen that's broken down into a more digestible form. It helps with bone mineralization, strengthens and hardens bone. So in your collagen supplement, look for the words that say bovine type 1 or type 3. These are the most bioavailable forms of collagen peptides. So C-telopeptide is a fasting lab test that you can have that tells us a lot about how your body is breaking down bone. So according to your medical situation, a standard blood draw can be ordered, CTX, or the urine test form of this is called NTX. The blood test is usually taken in the morning because fasting is typically required. It reflects the turnover rate of bone metabolism, which shows what is the level of bone breakdown in your blood. High levels of CTX mean that your osteoclasts, which are the bone cells that break down bone, are breaking down bone at a higher rate. But we don't take this lab test by itself in isolation. We always look at this lab result in connection with what is your P1NP test. So let's see what a P1NP is. Procollagen type 1 N-terminal propeptide, P1NP. No fasting is required for this test, but it's just easier to fast and have all these blood tests run at once. So what does a P1NP tell us? It tells us the level of bone building that your body is performing. So this test is taken together with your CTX. So one is bone buildup or osteoblast activity. One is bone breakdown or osteoclast activity. They need to be taken together because both work in combination, in a balance. So you don't want high levels of bone building and really low levels of bone breakdown because, again, this puts your bone metabolism out of balance. You want these to be balanced. So you take a ratio of CTX to P1NP to determine what is your overall bone building and breakdown. You take them together. You can also compare P1NP with NTX, but NTX is just a little trickier to have tested, and I'll tell you why. So NTX is a measure of bone breakdown markers in your urine. In order to test this, you need to collect your urine into a gallon-sized bottle over a 24-hour period, and be sure that you keep the gallon-sized bottle in the refrigerator. So yes, an NTX is a little tougher to get. I believe the blood marker CTX is just fine and shows us what we need to know about your bone building and bone breakdown. So most people should be taking vitamin D daily, at least 2,000 IU's per day. Again, if your vitamin D levels are low, you may need to increase this to 5,000 IU's a day. And if your vitamin D levels are really low, you may need to increase this short term to 10,000 IU's a day. Calculate your CTX to P1NP ratio. If this ratio is below 150, then your bone metabolism is out of balance. So that tells you a little bit about how your body is handling bone building and bone breakdown, which should be in balance. Take a bioavailable collagen supplement daily, bovine type 1 and type 3 up to 5 grams per day. There are many good collagen supplements on the market. I happen to like the AlgaCal Collagen Complete Supplement. Take a bioavailable animal-based or marine-based calcium mineral supplement daily. Once again, I like the AlgaCal Plus products. They're very bioavailable. They have an AlgaCal Plus, and it has strontium in it, which is not strontium renolate, which has been shown in the research to cause some problems. It's strontium citrate, which is very bioavailable. Take adequate vitamin D and vitamin K2 as MK7 supplements. Again, I don't work for AlgaCal, but they have a D3 complete that's very well balanced. It's A, E, D, and K all in one tiny supplement. So I have really been pleased with how they've been formulating their supplements. Balance your daily calcium intake with magnesium glycinate, which is a more bioavailable form. I would suggest that most people need to take 400 milligrams twice a day of magnesium glycinate. For bone density, building bone density, consider whole body vibration 10 minutes a day. This is a vibration platform that you purchase. It runs at certain hertz. That is very good for bone building. And I happen to use myself the Life Pro Rumble X 4D vibration platform every day for 10 minutes. Consider heavy resistance training 2 to 3 times per week, such as powerlifting with barbells. Consider use of a weighted vest, 30 minutes while walking twice a week. They have weighted vests you can order where you start really low on the weight and then add weight as you adapt and get used to wearing the vest. Here's some references that I used for today's presentation. Thank you for listening to part 5 of a 5-part series on Blood Work 101, how to interpret lab results from a metabolic health perspective. If you have questions for me, you can email me at melanietidman@gmail.com. Please remember to subscribe to my channel. This really helps me a lot. Hit the like and notifications buttons so you'll be informed of future videos that I post. And if you'd like, make a comment in the comments section. Let me know if this was helpful for you. Again, thanks for stopping by my channel. I'll see you on the next video.